Okay, we have Mrs. and Mr. Gandia from the Philippines here, and that is their daughter, Miss Gandia, in the back, and she is from Bakersfield. And Mrs. Gandia here on the left, she originally came in to see us because you were having dizziness attacks and episodes.
Yeah.
All right. And how often were you having those?
Very often.
Very often.
Very often?
Yeah.
Say how many times a week?
Oh, almost every day.
Almost every day.
Yeah.
And they were visiting from the Philippines, and so they came into our clinic to see us. And how long have you been with us, Mrs. Gandia? How many months now?
3 months.
3 months.
Yeah.
Months.
And you get to go home when?
February 5.
So she's next week. She's going back to the Philippines, but she's going back to the Philippines because you're no longer having what anymore? You're no longer having what anymore?
Dizziness.
Dizziness.
Dizziness. What are some other things that have?
Gas pain.
Yeah.
Uh,
Talk about your energy a little bit.
Yeah. You feel more what?
I feel more energized.
Energized.
I'm strong.
You're strong.
Yeah.
Excellent. And before your daughter
I'm
was
starting to do my normal work,
okay.
Activities.
my normal activities
Mm-hmm.
at home.
Okay. And
My BP was attack of my blood pressure was reduced.
so your blood pressure used to be really high when you first came in,
Yeah.
and you've lowered one of your blood
Yeah.
pressure medications. You're no longer taking it.
Yeah.
Okay.
She's no longer on your cholesterol medication.
Yeah, I am no longer on my cholesterol medication.
No longer on your cholesterol medication, and your cholesterol is actually lowered when we just went over your recent blood work,
Yeah.
even though you're not on your medication anymore.
Yeah. Yeah.
Yeah.
Right.
Tell us about when you used to drive.
Yeah. Whenever I would drive from Bakersfield to here to take her to the clinic, to the therapy, I'd be driving slow as like 50 miles an hour, and she'd still be dizzy all throughout the drive. But now I'd be driving 70 miles an hour, and she'll be woo, feeling like not noticing anything at all. That I'm so fast already.
So before you just couldn't drive even the speed limit because the
Yes.
dizziness episodes would occur.
Yes, exactly.
Okay. And now you get to go home next week.
Yeah.
If there was a woman in your position that was having the same thing, what would you tell her?
I will tell her to go to US, see Dr. King.
Go to the U.S. to see Dr. King?
Yeah. Visit him, and
Because his therapy really works.
yeah, because he has done great.
Well, thank you very much. Anything else you'd like to say to anybody that might be watching?
Yeah, like, wherever you are, don't hesitate. If you know that, your medical doctor has done everything and you're still feeling the same thing, don't hesitate to try, like, new things, like what Dr. King has done to my mother. So it's worth the trip coming from the Philippines, go here, have the treatment, and now she's coming back with the better life.
Better life,
Yeah, better health, yeah.
better health than when she came.
Yes.
And you guys were driving from Bakersfield, and how far is that from our clinic?
Like 140 miles.
140
One
miles,
way.
one way.
Uh-huh.
One way. So was it worth the drive?
Very worth the drive.
Mrs. Gandia, was it worth that drive?
Yeah.
Mr. Gandia, was it worth it?
Yes.
Yeah.
Really, really.
Worth the time and the investment?
Yeah.
We went to say thank you to Dr. King and to Miss Marie
Well, thank you very much.
for getting me well.